Thank you, Dr. Shruti, Sarika, and Dr. Neha Kakkar for such a wonderful session in the evening. And
Thank you, sir.
thank
And if
you.
you all want to listen me, you can
Yes,
stay now. I will be presenting the session now.
yes, sir.
English
That's
session,
the
English
reason
session.
why
Yeah,
I
yeah.
didn't mention your name, sir.
I will wait, sir. I will wait, sir. Definitely, I will wait, sir.
Good evening, good afternoon, and good morning. This is the 1865th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Mridul Kumar Sahani, sir. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, the local language session in Malayalam. We are uploading the videos of the same on the very next day so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathy lover, doctor, or a student. It doesn't matter much. The purpose of the forum is to take homeopathy to every home around the world. And as you all know that we just celebrated our 5th anniversary of the continuous uninterrupted webinar on September 28th, and it was a big success and a lot of some international personalities as well as some famous doctors from North India also there with us. So it really was an international session and we really enjoyed the day. Even though Sahani sir was not able to come over there, sir was with us and sir was the person instrumental in bringing out, authorizing in getting our Aish minister to inaugurate the session. And we are lucky to have such a wonderful personality here. Today, in this evening, we have with us our teacher of teacher, Dr. Mridul Kumar Sahani sir. As you all know, sir was the former CCH member as well as a chairman of some commission there. And sir Sabi is having more than 55 years of clinical practice, as well as Sir is the uh, proud scientific committee chairman of IFPH. And Sir has presented some of the best papers in this forum. And today, Sir will be talking about journey of flu, new destination tomato flu. There's something um, ex extraordinary from Sir you is expecting today. So we are waiting for the session. Welcome, sir.
Just I'm trying to upload my PPT now. Yeah, tomato flu, I got it. Uh, yeah, so I'm ready to talk with you. How many of you are frightened to see this presentations? Because we all have the tomato in our daily routine. And tomato is one of the most favorite food, I think, for everyone. But is it a problem or is it only a something else? Tomato, as you say, as I see that we are talking about the tomato flu, that means the flu that is being caused by the tomato. But it is not like that. It is not like that. It is not the tomato has got no any relationship with this type of the flu. So this is the journey of the flu, which has traveled through the different stages. The first, another stage you might have heard of the swine flu, the bird flu, the tiger flu, and what many things may come up in future. So it is a continuous thing, and every time it is getting evolved. Now, but why this time they have named it tomato flu? It is only because of the symptomatic presentations, that the lesions and the inflammations that look like a tomato redness. That is the only thing that is related to, and that's why we call it the tomato flu. Friends, this topic is very new, and I think I have earlier treated this type of the case, but I was not aware that it is a tomato flu. But it was like that because the flu is very unpredictable, and when it begins and how it takes off, we don't know where it can go. And you know that the society is changing, life is changing, and everything is getting changed. And why it is changing? Because of the mutations, because of the viruses are mutating themselves, bacteria are mutating themselves, we are mutating ourselves, and we are trying to mutate every time. So this is the unpredictable things, when the things will come. When the bird flu came, millions of the birds, chicken and eggs were destroyed. When the monkey flu came, then millions of the fruits were destroyed. So why it is like that? It is not this. They are not responsible. They are the good. They are the our companion. They are the part of our nature. So we should not blame that, and we should try to avoid naming this type of the. Otherwise, we can have the another things. Now, in this presentations, I am giving time to give you the introductions and terminology. It's historical flu of the tomato, historical reports of the, and first report of the tomato flu, virology and pathogenesis, and then epidemiology, who, where, when, and transmission, then clinical features and natural courses, diagnosis, then clinical and laboratory approaches, differential diagnosis, how to distinguish, and then conventional treatment and public health measure, then homeopathic perspective, philosophy and framework, then homeopathic remedy that you can think of, and the practical case management with the examples, safety measures, then prevention measures, evidence, limitations, research, and the conclusion, and then finally this. Yeah. So tomato flu is also known as tomato fever in some reports. It emerged as a public health concern in some part of the India in 2022, recently 3 years back. And the name tomato red flu is referred to the tomato redness, often painful blisters that were described in the affected children. Over time, clinicians and researchers concluded that illness mostly resembles the atypical presentations of hand, foot, and mouth disease, and frequently due to the coaxis viruses, this is called CS16 and other enteroviruses. The illness usually self-limiting in children, and management has been supportive. So in this article, we are going to this all these study, and we are trying to. Now, terminology. This is a terminology. Tomato flu is a colloquial term that common nickname that we used to give. So tomato fever came into wider use during the cluster febrile illness with a striking red blistering lesions reported in 22, especially in Kerala. It started in Kerala, and it is now spreading. The phrase is descriptive rather than etiologic. It refers to the tomato-like appearance of certain skin lesions described by the caregiver and clinicians. Subsequent clinical and laboratory work shows that many cases fit within the spectrum of hand, foot, and mouth disease. This is the another area where this is available. Or similar enteroviral illness, sometimes with the physical atypical larger blisters. The recommended clinical response that has been emphasized: symptomatic care, hygiene, and surveillance while avoiding. The worst, you may be aware about the Bill Gates message. The worst pandemic in modern history was the Spanish flu of 1918, which killed 10 of the millions of the today. And today, with how interconnected the world is, it should spread faster. And it is going on. It is going on because only it is because of the suppressive treatment that is being followed by the modern medicines. And we should, as long as we try to suppress or kill the viruses, and it is not going to be removed. We have to learn living with the flu, living with the viruses and the bacteria. We have to develop our own immunity. This is important. As a homeopath, I can say, unless and until we develop our own immunity, we cannot remove these things from the on this from this planet. Initial report which came in 22, earliest in Kerala, as I told you, in 2022, report described young children, primarily 5 years old, presenting fever, fatigue, oral lesions, and painful red blisters that something grew in size like to a small tomato. Media and local health authorities circulated alert, and clinicians investigated etiology and possible public health implications. Then rapid clarifications by the clinical investigations, as sample were analyzed and case compared to known illness, many aspects concluded that the phenomena represents an atypical presentations of hand, foot, mouth, and disease that is caused by coaxis and other enterovirus, or possibly post-viral inflammatory blistering following dengue or chikungunya in isolated report. Over time, the weight of evidence supported HFMD disease enterovirus explanations rather than the unique novel viruses. Then global attentions. Because of the striking lessons, descriptions of the post-COVID heightened sensitivity, the new febrile illness, international media and some scientific outlet discussed the outbreak widely. Now, the attention was drawn, and most of our attentions are drawn towards the medicines, toward the disease only after the COVID. We have become alert. We have become alert because we have been so much terrified with the COVID. So every time anything happens, that is taken as very seriously. However, follow-up epidemiology and virological study placed tomato-free in context of the enteroviral syndromes here. Then causative organism, this is caused by non-polio enterovirus in the pico-narrative family, and common causative serotype include coccicovirus A16, CA16, and enterovirus A71, EV A71, but many other stereotypes like CV A16, A6 can cause the HFMD-like disease. It is not that the HFMD disease is caused by single type of the virus. It may have the many other resources to get it. And tomato labeled case have often been associated with the CA6 virus or considered a typical HFMD presentations. So pathogenesis, as we have already heard, enterovirus replicate the oropharynx and gut mucosa, spreads via respiratory droplets, contact with blister fluids and fecal oral routes. Then viremia can lead to the mucocutaneous lesion, that is on the mouth, ulcer, vesicles, and hand, feet, and buttock. And rare case, more severe systemic involvement, neurological complications are observed in certain extent. And most infections in immunocompetent children are mild and self-limited. Who is affected? It's primarily affected the young children, especially under 5 years old. And older children and adults can be infected, but with the milder or asymptomatic. Why the younger children are affected and why the elders are not getting affected? This is very, and we have to think about it, because the newborn children, new coming up the children, they have so much sensitivity. That's why they have the tendency to acquire any type of that. And as we grow up and start living in the environment, we adjust ourselves, we develop our immunity, and the things start coming. You might have heard that the child was born and up to 3 years, 4 years, frequently was having the fever, and later on after 6 or 7 years, no fever and everything gone. In 22 Indian clusters labeled tomato flu, most cases were toddlers and preschoolers and the Open School Health Journal. And where and when? So in many regions and especially in the summer, autumn and temperate zone. In 22 early clusters termed tomato flu was reported in the Kerala states, Tamil Nadu and Orissa, and clusters were reported in May, September in multiple localities. How it spreads, person to person, or respiratory droplet, not through the tomato. Once again, I will emphasize that it is not because of the tomato, it is person to person with the respiratory droplets contact by blisters, fluid, contaminated surface, or fecal oral transmission. Children in close contact setting, daycare, play groups are of the particular risk, and environment contaminations, toy, beddings can be facilitated spreads. The incubation periods are usually 3 to 6 days. Attack rate and severity. Most cases are mild and self-limiting. Death and severe complications are rare, but have occurred in outbreak, particularly in the virulent type. That is during the epidemic in some countries, not in India. And tomato labeled case reported in India were generally non-fatal and managed by things. Then typical presentations, prodrome. Now, this is very important for all of us to listen. For any type of the illness when we see, we have to see that what aura, the word aura has been talked widely in our homeopathic system of medicine. So aura means before the symptoms starts, what are the predorm, then during, and then after. So if you can, if you are able to diagnose, if you are able to observe the predorm, then during the conditions and prodrome symptoms, you can get a better explanations of the medicines. So prodrome, fever starts with a low to moderate melasma feeling, decreased appetite, irritability, and sometimes sore throat. Then with the oral lesions will be there, painful enthymema, and a small vesicle ulcer on the tongue it starts, buccal mucosa, palates, and that cause feeding refusal and dehydration risk in the young children. Then cutaneous lesion. First, a small vesicles starts in the palm, soles, and sometimes in the buttock, genitalia, and widespread, described in tomato report as particularly red and sometimes larger than typical HFMD lesions. Hence, tomato description lesions may be painful and puretic. Systemic feature, the patient may be feeling fatigue, weakness, malaise, pain in the muscles, joint pain in older children, and occasionally vomiting and the diarrhea. Now the courses is most of the time it resolves within 7 to 10 days. The skin lesion crushed and heals without scarring in the majority. Rarely neurological or cardiopulmonary complications can occur with some enterovirus strain. And notable features of the tomato cases, many reports emphasize the larger intensely red blisters and distribution, sometimes extending beyond classic hand, feet, mouth, and buttock trunk. The clinical picture overlapped heavily with the HMT and clinicians treating these cases usually supportive measures with a good outcome. Then clinical diagnosis, how you can diagnose it. It can be diagnosed primarily by the triad of the fever, oral lesions, and vesicular rashes. The striking red blisters described by caregiver can help you the recognitions, but atypical distributions require careful assessment. Then laboratory confirmations, throat, virology, throat swabs, vesicle flu or stool specimen can be tested, PCR for enterovirus, RNA, and type identify CA16, EVA71, and CV6A6. Typing is recommended for health, the public health surveillance, and routine blood test, it is usually not a diagnostic feature, may be done in if there is some concern for the systemic involvement. And when to test, usually during the severely neurological symptoms, unusual severity, breakout, or when public health authorities require the confirmations. Then, because red blisters and fever, children can replicate multiple disease considered, hand, foot, just as I told you. The closest match to tomato is the NCBI, that is according to the NCBI. Then varicella, the chicken pox, widespread, you can compare it as a differential diagnosis, widespread vesicles at different stages, typically and most generalized with centripetal distribution. So you mind it, it is a centripetal distribution and often severe duration. Impetigo, then bacterial skin infections, it is honey-colored crust, localized, may be surrounded by cellulitis, bacterial and cultural. Then it may reflect the presentations of herpes simplex sometimes because of the primary gingivitis. So intense oral lesions, fever, often grouped vesicles. Then hand dermatitis or allergic contacts, you have to, and then monkeypox is also historically it has been seen. So deep-seated lesions of the monkeypox you have to compare with it. Then scabies. This is quite different from the scabies because scabies and secondary infections are intense urethritis and borrow with from the nocturnal itching. Then dengue and chikungunya is also important. We have the rashes are there, so but it is not that tomato-like. Then clinical context, contact history, seasonality, clustering in daycare, plus simple inspection usually allow a working diagnosis, laboratory test, differentiation only when necessary. It is not necessary that you can go further. Yeah. So management principle, supportive care is required, adequate hydrations, apathetic medicines may be used, paracetamol may be used, but in our homeopathy case, we may not, we do not suggest like this thing. Then skin care, we have to take care to prevent this scratching or so smooth bathing, oatmeal, protective dressing is required. Antiseptic may be used for the secondary influence. Then isolation and hygiene is most important. We have to isolate the patient for sometimes and strict hand washing, cleaning, toy cleaning, and linen and disinfections of the surface. Transmission of occur lesions, crust or virus insect the stool. Then when to hospitalize? Yeah, severe dehydrations to maintain the oral intake. Sign of systemic involvement, neurological symptoms like lethargy, seizure, neck stiffness. So in the severe case, we can think about hospitalizations, respiratory compromise, persistent high fever, and poor perfusion. Then suspected severe enteroviral complications like encephalitis, myocarditis, we can, for the pediatric assessment, we can hospitalize. Then vaccination. So now, till now, no vaccinations has been found, and in some countries, some specific older vaccinations are used. There are no widely approved antiviral for uncomplicated case of this year. So from the homeopathic point of view, this febrile exanthema, fever with rashes and blisters, are approached according to the classical principles. We all are here, seated here, are follow the classical rule of finding out the totality of symptoms, selection of the remedy, a repertorial analysis, and then patient characteristic symptoms, pattern, mental, emotional state, and concomitants, and rather than solely the disease level. So our primary role are individualizations. Two children with the same blisters may receive different remedies depending on the temperament, intensity, irritability, modality. Then acute versus chronic management. In acute febrile blisters conditions, the homeopathic often uses acute remedies and with the low potency or sometimes in the high potency also. In chronic constitutional prescription for the longer process. Then symptoms matching for the acute febrile and eczema. So we have to closely, this is very important for us to understand that symptoms matching for acute, this is a very, every time when I talk about the chronicity and acute, I say the acute symptoms are very important for selecting a proper remedy and finding out the symptoms, because symptoms are here in exaggerated or in heightened positions. Then adjuvant role, then again also this is now it is being required. You can use it homeopathy in many settings as a supportive conventional measure, especially important in pediatrics to ensure hydration and prevention complications. And topical versus systemic. Some homeopaths use topical homeopathic ointment like calendula preparations for wound care. Others prefer systemic constitutional remedy. It depends on you to whether you feel that some ointment can be applied or not. And then evidence of homeopathy prescriptions is limited and they should not delay standard wounds infections management. So now below, so we have to be very important feature is that remedy selection must be individualized. Please note it, must be individualized. The list below pairs the remedy with the cardinal indications, mind, concomitant, local symptoms, and modality. Potency and repetition depend on the patient's vitality, severity, and practitioner judgment. And for infant and frail conditions, low potency and less frequent are usually used. Now, some of the remedies that we can, this is therapeutic use, but mind it, every time when I say that and speak about the medicines, I always cautions everyone, don't take it as a takeaway message. Belladonna, it is indication is sudden onset, hot, dry skin, flushed heat, throbbing headache, bright red face, skin with intensity, red, sensitive to touch. When to use? When fever is high, child is in hot and flushed with red inflamed lesions, and that seems intense and sudden. Then Apis mellifica, it is swelling, stinging, burning, pains, lesions with edema. Patient may be restless and want cold applications. For Apis mellifica, cold applications is very important and heat intolerant is there. It is used basically for vesicular lesions that are swollen and burning. Then cantharis is another important medicines where burning blisters are there, intense burning pain, and when the lesions of vesicles are burning. So it is for the painful burning vesicles, dysuria, there is a urinary involvement is also there. Then rustox. This is also a wonderful medicine. Intense restless eruptions that are vesicular itchy, worse on first motions and better by the continued motions. That we all know. And then skin eruptions may be vesicular and raw sensation or restless and emulation by the. Then pulsatilla is also very important. The patient is very mild. If the temperament is very mild, weeping desire, consolation, and skin lesions which are bland, shifting better in open air but worse in the warm room. So for now the children who are very clingy nature, tearful and have mild eruption. Then arsenicum, it is for the anxious people, anxiety about health, burning pains relieved by warmth, prostration may be used in the severe exhaustions when vomiting, diarrhea causes the dehydration. And there is a marked restlessness in the arsenicum, burning, prostration, and thirst for the small one. Then mercurius, merksol, and mark bite. Profuse salivation, ulcerative lesions in mouth with offensive smells, tendency to sweating, worse at night, and swollen glands. So it is used in the offensive secretions. Then herself, it is very sensitive to pain, supportive tendency, or if secondary bacterial infection suspected, uh, extremely irritable and chilly, worse from cold drafts. So it is used uh, super infected, and there is a tendency to swell. Then calendula similarly, as a local dressings, some people are using, so we can use it. Natrum muriaticum, if the patient demonstrate emotional feature, introverted, grief, reserved, with a dry mouth and small lesions, and commonly in acute exanthema, must be possible for the constitution. Econite is the first remedy. Onset of the high fever, sudden exposure, cold wing, intense anxiety, earliest hour, and sudden febrile onset on other virus. Natrum muriaticum, characteristic emotional feature, introverted, reserved, grief with dry mouth. Now, practical potency guide for acute children infections. Many homeopaths use low to medium potency, 30 to 6 potency for acute conditions. But I suggest to use go for the higher potency, like 200 or more, when you have the totality of the symptoms. If you have the complete matching of the constitutions, always go for the high potency, not for the low potency. For the infant also, the low potency is required. Why it is said that use the low potency in infant? Because the symptoms are not so clarity. We are difficult. But when you get the clarified symptoms, it is not necessary that you should use the 6 or 3. You can go for the higher potency. And for the children, I usually say that when you get the sensitivity, because higher the rule of the potency suggested by Dr. Henneman was the higher the sensitivity, higher the potency. Higher the sensitivity, higher the potency. So practical potency stop and recession. If no improvement after a reasonable trial 24 to 48 hours for acute remedy, or if conditions worsen, consult pediatrics on consider changing of the medicine, seeking conventional care. And safety, avoid delaying medical evaluations for dehydrations, fever, severe pain, or neurological conditions. Now I'm giving you to the illustrative case with that I have treated. It is a typical, but I don't say that it was tomato flu, but it was like tomato. And recently I recognized this, and that's why I'm putting this. I have not treated that defined tomato flu, but it is similar to that. That's why I'm presenting. So a 2-year-old child with 24-hour history of fever that was 38.5 Celsius, poor appetite, crying when feeding, was brought to us by his mother, red blisters on buttock and small vesicles on hand. Child was restless, want to be continually carried and hot to touch. Then parent were worried but insisted to treat and provide immediate relief. Child was also not drinking water with restlessness, keep crying during the consultations, and mouth carried it on the shoulder. It was frightened easily with the loud noise, and there was a fear of the dog was also noted. The patient was, when the patient was, some sound of the barking of the dog was there. So he was so much frightened that I noticed personally. Then rubrics that I selected: mind, weeping, eating while children in, restlessness children in, carried desire to be, heat of the affected part, skin eruptions red, skin eruptions vesicles, and fear of the noise and fear of the dog. So what are the medicines? The medicines is definitely, this is the repertorial analysis. And you see the well-indicated belladonna is coming up here in this repertorial sheet. So belladonna was the first choice, and as I present the medicine cases with the transmission method only. So I started because there was a complete totality. So I here started this treatment with the 0/7. Usually people say that you start the 50 millismol potency with 0/1, but I have experienced during the corona season pandemic that in the corona season, only this higher potency are working very well. And within 4 to 6 hours, child become calm and slept. Vesicle started reducing gradually and were completely vanished within the 3. Then another case was painful mouth ulcer, refusal to drink, presentation 9-year-old, 9-month-old fever, 15 days. Child was extremely restless. It was unable to eat or drink because of the ulcerative eruptions in the mouth. Urine output was reduced due to the minimal intake of the water. When we saw the in the mouth, it was reddish. So we selected these rubrics. Now see, handling it during the acute conditions, how simple that you can find. Only have to observe mind restless children in mouth eruptions vesicles, mind company desire alone when aggravate, frightened easily, dullness children in stool odor offensive, mouth salivation slip during, and carried desire to be. The lycopodium, Merck and Foss are the totality that was coming close to each other. But considering the offensive mouth and salivations, we selected Mercksol 0/5 potency, and it was reported very next day, the fever reduced drastically and child was feeling better. Within 5 days, all vesicles vanished and single medicines was able to restore the health within a week. So now safety measures, what we can think of, immediate medical attention required when any of the following occurs: sign of dehydration, dry mucous membrane, sunken eye, low urine output, lethargy, poor skin trigger. And then neurological sign, irritability beyond baseline, drowsiness, seizure, neck stiffness or focal deficit, severe systemic features like persistent high fever, difficult breathing, poor perfusion and cyanosis, feeding refusal. So this is also very important. Then rapid progressions. So in these situations, immediate pediatrics hospital care is also recommended. But if you are able to confident enough, you can use them. So now the preventive measure, we have to we have to give the console the patients and counseling during the hand washing, frequent hand washing with soap, especially after diaper change and toilet use, surface cleaning, and disinfectant of the toilet surface, bedding, and frequently touched objects in childcare setting. Then isolation is most important. Then public education is also very important. Inform your patients or the surroundings, dehydration risk and need of the hygiene and early pandemic pediatric evaluations for feeding difficulties, and then surveillance. Timely reporting to the public health authority is also very necessary, and it is your mandatory also for every practitioner to report to the public health authority. So now what the literature shows, some of the evidences that we want to see. A scholarly review in and case series published after 2022 clusters concluded that most tomato flu cases fit with the atypical HFMD and are generally self-limiting, requiring supportive care. And severe peer-reviewed articles summarize clinical patterns and public health implications. So homeopathic evidences, high quality randomized controlled evidence for the homeopathic intervention in HMT, tomato flu or acute enteroviral viruses illness. Most homeopathic practitioners practice guidance is derived from Metra Medica, repertory, indications, clinical traditions, and case report rather than the large RCT. There was no such RCT trial was done. Then research opportunity, it is very much important that the well-designed observational study and randomized uh, comparing adjuvant homeopathic care should be carried on, and we have to standard cares during this type of the so ethical designs should be ensured, not holding. Then research, prospective cohort study is also required, natural history with this. Then randomized controlled trials is also required for the well-defined cases, and laboratory studies should be done. These are the recommendations. Then public health studies is also, survey is also necessary. So in the end, I can only conclude that it is the outbreak which started in India, and but not, I said India, it was there all in earlier area also, and subsequent clinical and virological work indicates that these cases predominantly represent a typical or variant presentation of HFMD disease caused by the enterovirus. Yeah. Then most cases have been mild and self-limited, and management limited supportive hydrations, fever control, hygiene, and monitoring. From homeopathic perspective, acute remedy selection is guided by individualization and the totality of the symptoms. Remedies such as belladonna, Rustox that I have mentioned earlier, and importantly, homeopathic care must be integrated with the standard pediatrics measure and must not delay urgent medical interventions with the red flag symptoms like dehydrations, neurological signs, severe. Yeah, present. So references are there. Are I have searched with the and taken some of the ideas from these of the articles. So these are the references. Then takeaway message is that for clinicians, consider HMT enteroviral causes by blistering febrile illness in children. Test, notify public health for clusters or severe causes. Manage hydrations and complications aggressively. Then for homeopath, use individualized acute prescribing, prioritize safety measures for red flags, coordinate with pediatric care, and avoid delaying urgent conventional treatment. Documentation is also important. You must have the documentation of each and every case. And for the patient and the parent and the caregiver, givers, we have to maintain the hygiene, keep symptomatic children at home, don't isolate them, ensure fluid, and seek immediate medical care if feeding declines or the child shows lethargy. So final note of safety is that presentation is an informal review combining conventional medical resources and the homeopathic clinical perspective, and it is not a substitute for direct medical evaluation. If a child is febrile, refuses fluid, has sign of dehydration, is usually drowsy, or had neurological symptoms, you must seek immediate medical care or emergency service. Homeopathic remedies had an adjacent role under the qualified homeopathic practitioners. So this is the message. Hey, flu, I guess we need a break up. I can't stay in this one side love of yours. You better find someone else. So next time we may come with another item like, and this is a journey. I told you that this is the new destinations, but journey continues. It will keep on coming and keep on coming with some different presentations. So every time the journey of you now find a new destinations. So with this, I thank you all for having a very patient listening to me. Thank you very much.
Thank you, Sahani sir, for such a brilliant presentation this evening. And everybody thought that it may be something different, but actually it was it just HFMD that it refined in a new way. And your presentation was, as I must say, exemplary, brilliant in all ways, because everything was mentioned. What are the things not to be done? What are the things to be done? But you have mentioned about the Kerala situation. As you all know that it was first reported during the time of chikungunya. That may be the season. And as you all know that it was first affected in Alleppey district in Kerala. That is my district. And it is in my district that happened. And we were waiting for patients to come over for this treatment of chikungunya. Then, as you know, most of the people went visited the allopathic doctors, and what happened was there was a rush. Patients have been found it very difficult to move, walk on, and they were treated with the antibiotics and strong analgesic, and as a result, some death has happened, and day by day, the death rate was going up, and there it was about to reach some 200 death at the time. By the time, but frankly, in those times, we as homeopaths started getting patients with fevers, and we realized that it is a typical case of chikungunya, and we were able to cure them within 3 to 5 days, and sometimes it may up to 7 days. And what we are at that time of the pandemic, I was the district president of our organization called Institution of Homeopaths Kerala. That is the biggest organization of a doctors community of homeopaths in Kerala. And some of a friend from advised me to take a video out of it and make a presentation into the press club. And what we did was that. One day I called the videographer to my clinic and asked him to take videos from 9:30 9 a.m. to 6 to 7 p.m. in the night. And after some 3 days, we took another video from the same time. In between, we got patients who visited me on the first day and the third day. What happened was most of them were relieved. We know that people were coming in a different way. They were not able to walk from. They were held by their bystanders, and when they're coming for the second visit, they are coming without any support, and that kind of relief was given by homeopathy. And then we took then we edited the videos, and when some of I took myself with some of my friends visited the take an appointment at the press club at Alleppey, and we have shown the press club that the homeopathy can do excellent way of treatment in this kind of chikungunya. And what happened was the rest is a history. Then the papers actually our homeopathic newses are just given in a short column, either in the back page or by inner page, or nobody may not be realized. But they took five column newses in the front page of the newspapers, and they told that homeopathy has a solution. Homeopathy has the better treatment for this chikungunya. And not only that, we have a preventive medicine also. So everything went viral, and people rushed to each and every homeopathy clinic in a just like Pete Piper's way. And thereby, homeopathy established once again that homeopathy can do wonders in those kind of diseases. What I observed during the time was that some people came to me to us with this kind of bubbles in their leg and feet and their hands, and most of them were treated by allopathic medicine. Actually, this was really in those time. These modern people diagnose it as a case of this tomato fever, but actually it was not really the tomato fever. Actually, it was due to some medication. That's what our observation. But because when we people treated, there is no such complication happened, because most of the thereafter the allopathic people are not cared about treating this chikungunya. They even directed patients to, you just better go to homeopathy. They can do in a better way like that. So that was one of the observation. Whenever they find it very difficult to move on, they may say that it is a case of this. And the same thing has happened at the time of COVID also. When COVID was treated by those people, a lot of death were happening. But when it come back to homeopathy, the number of person there of death was very, very less. There was most of us treated the COVID without any causality. That's what we have noted. And at the time, we know that then there were people who are coming with red eyes and a lot of problems. Then they called this as the black fungus disease. Actually, that was also not. Actually, those people who took those medicine high intensity have developed such things. And I was a person who got such one of the such cases, and we were able to treat because I never told them it's a case of black fungus. The patient himself told the people that it's a black fungus because they when they visited the medical college, they told him that it is written in the prescription that it's a fungal disease. So people naturally because then what happened was this person uploaded a video saying that Dr. Danesh has cured a black fungus case, and I got it. There are some people from the other side reported the same against me, and the medical council has sent a letter to me to give the answer why and how you treat this patient. There is no because we all know that the black fungus cannot be treated by a person. We have to report to the medical authorities. So I have to give my opinion there because what I told them that what I just did was the homeopathically, because we don't mind about the name of the disease, but instead we just take the symptoms and we just go in that way of treatment. So these are the things I would like to add to the session, sir. This is actually nowadays we are getting a lot of this HFMD that usually, but nobody is having no much fear nowadays because homeopathic doctors can manage it better than any other system. In the early days, we used to get a lot of measles cases, but nowadays and chickenpox cases. But now this comes in between them. That's what I have noted. The number of eruption may be comparatively less when we compare to measles or chickenpox, but it is restricted to certain area. Actually, when we open the mouth and we just look into the patient, we can see that some blisters are there in the mouth, as well as you look at the feet. Then we can see some of the red eruptions coming out on the feet also, as well as in the hands also. That's why it is called the hand, foot, mouth disease. And we can see, as you rightly point out, all those medicine mentioned, and particularly Prozac has a wonderful role to cure this medicine. Because most of patients having no thirst and having the symptoms and say so almost all viral disease Prozac has upper hand according to me, and from my experience, not it is a theory, but from my experience, what I have not, of course, belladonna, sulfur syrup-3 can do wonders. Even a single, I have seen that the sulfur syrup-3 in a single dose has cured so many cases of this tomato fever. Actually, it is, as you rightly point out, that it is not connected with the tomato, but because of the shape and the beauty of tomato, that may be the reason why these people call that it is a frightening disease. But it is, we can easily manage, and of course, in the end, if at all any dehydration happen, you can advise for this kind of drips and everything. But actually, it is not a necessity because we are treatment while treating homeopathy medicine, we never get to such complications. We need to care about the food habit also. Then some people have
That was
excessive salivation from the mouth also. In those cases, we can think of some other remedies, particularly Mersol also come into that picture. What's your opinion on that, sir?
that was a nice deliberations and from your talk, talk, I say that as only I mentioned Kerala to be the starting point. It is not like that, because what I see that in our the patient from that I mentioned here was not from Kerala. He was from our region of Bihar. So how we can say that it started only in the Kerala? That is the point. Only thing is that it was reported, the public or health authority, they mentioned it for the first time. That's why it is said that it is in Kerala. But it is
Yes,
spread in the different part of the country. Different part of the country. So we don't need to mention these things. But the authority, we have to believe the public health domain for about this type of the things. Then what you are talking about the presentations, that is quite right. That we have to be very careful about the homeopathic aspects. And we as a homeopath are quite different from the allopathic physicians. And usually patient whenever a patient comes to us from treated by allopathic physicians, what happens? They take a longer time to be cured. Why? Because they use different type of the medicines, usually suppress the symptoms, and some another complications arises. And to remove all of them, all those together, it is very difficult things. So the patient who comes directly, those patients I mentioned in today was direct patient to me. But there are sometimes of the patient are coming and they are not cured within 2 3 days. They take about more than that. This is the this is the things, because they are complicated and more complicated because of the so many symptoms. So this is very important for all us to understand that we have to be careful also in reporting, because the public, we are answerable to the public health. So immediately naming the disease or telling that it is tomato flu or it is this or that disease, we have to be very careful about the diagnosis. We must have the evidence-based information so that we can prove it, so that to the public health authority before we show them. It is not only the video that is required. We have to, the pathological reports are also important. They have to be mentioned and they have to be taken care of. I think the time is getting up. 9:30 is
yes,
there
sir.
already,
Yes,
and
sir.
Shaila is
Yes, sir.
waiting. Shaila
Yes,
is
sir.
waiting for us.
Yes, sir. I
So we
am
can.
inviting Dr. Rambaresh sir to say vote of thanks to the session. Yes, sir. Please unmute.
Energy and communication. Sir, very nice, excellent session. Tomato flu, any types of viral disease, and skill based excellent session. Very nice, and feel the body suit and community multiply the very good remedy in antiviral, tomato flu, another. Very, very thanks, sir. Behalf of IFPH. Thank you, sir.
Thank you, Ram Parvez.
Thank you, sir.
Yes, it was really an excellent session, and everyone really enjoy the beauty of such presentation, and not only enjoy the beauty, but also full of knowledge. That's what, as we used to say, that you are the master of teachers of teachers. That's what we have
Dhanesh,
mentioned.
Dr. Dhanesh, don't find myself to the master. I always find myself to the student. I learn from everyone. And I always want to remain as a student. So don't call me the teacher of
Yes,
the teacher, call me the student of the student.
yes, sir. Yes, sir. Thank you, sir. Tomorrow we will have a session from Dr. Reshmi Shukla, and
That is also
thank
very
you,
nice.
Sahani
The
sir,
Rashmi Shukla is also very nice. Yeah.
and those who attend the session. We can meet tomorrow at the same time. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.
Thank you, Dr. Danish. Thank you, Sahani sir. Very happy to see you. എല്ലാവർക്കും
I would have met you at Cochin, but you know that how it is difficult for me to travel. So I just apologize for not be physically present, but mentally I was there for the whole day session. I was there.
Okay, sir. Thank you. We can understand your situation.